What you are about to feel over the next 30 seconds is not just a balance challenge. It is a cardiovascular event. Your blood is redistributing. Pressure sensors in your neck and chest are firing. A muscle in your calf that cardiologists have nicknamed the second heart is contracting, squeezing venous blood upward against gravity at a rate it could not achieve while you were sitting. And somewhere in the base of your brainstem, a reflex loop that operates faster than conscious thought is adjusting your heart rate and the diameter of your blood vessels beat by beat to keep your brain perfused while the ground beneath you shifts. None of this is happening because you are exercising. None of this requires effort. It is happening because you are standing on one leg, and that single fact has changed the mechanical demands on your circulatory system in ways that sitting in a chair, lying in a bed, or even standing on two legs cannot replicate. This video is about what is actually happening inside your blood during those 30 seconds. The physics, the physiology, and why a group of researchers studying mortality in middle-aged adults found that this specific test, holding a single leg stance for 10 seconds, predicted whether you would be alive in the next decade with a statistical power that rivals conventional cardiovascular screening. We are going to start with a problem your body has had since the moment your ancestors stood upright, approximately 4 million years ago. Gravity. When you are horizontal, lying down, sleeping, your circulatory system has a relatively simple job. The heart sits roughly at the same level as the brain, the legs, the liver, and most of the organs it needs to supply. The pressure required to move blood from the heart to the extremities and back is modest. Venous blood, the blood returning from the tissues back to the heart, flows with minimal resistance because there is no gravitational column pushing against it. The moment you stand up, everything changes. The heart is now approximately 130 centimeters above the floor. The veins in your legs are now carrying blood that must travel upward against the full weight of a fluid column stretching from your foot to your chest. The hydrostatic pressure at the ankle of a standing adult is approximately 115 millimeters of mercury, nearly the same as the systolic blood pressure in your brachial artery. That is the gravitational load your venous return system must overcome every second you are upright. Your cardiovascular system has two primary solutions to this problem. The first is architectural. The deep veins of your legs are not passive tubes, they are valved conduits. Every few centimeters, a pair of leaflets made of endothelial tissue open upward and close downward. When blood flows toward the heart, the valve opens. When gravity would pull it back down, the valve snaps shut. Without these valves, standing upright would cause blood to pool continuously in the legs until perfusion to the brain dropped to a level incompatible with consciousness. Varicose veins occur when these valves fail, and the pressure of the pooled blood begins to permanently dilate the vessel walls. But valves alone are not enough. They are passive structures. They open when pressure pushes blood upward and close when it does not. They require a force to generate that upward pressure in the first place. That force is the skeletal muscle pump. Buried inside the calf, running from the knee to the heel, is a flat, wide muscle called the soleus. It is not the most visible muscle in the leg. The gastrocnemius, the diamond-shaped muscle visible on the back of the lower leg, gets more attention. But the soleus is where the real cardiovascular work happens. The soleus contains large venous sinuses, reservoir-like pockets of venous blood embedded within the muscle tissue itself. When the soleus contracts, even slightly, even with the micro-corrections of balance maintenance, it compresses those sinuses. The pressure inside them spikes, the valves above them open. Blood is ejected upward toward the popliteal vein behind the knee, up through the femoral vein in the thigh, and toward the inferior vena cava and the right atrium of the heart. Cardiologists refer to the calf muscle pump as the peripheral heart, not metaphorically, but mechanically. It provides roughly 3/4 of the venous return from the lower body. Without it, you would lose consciousness within minutes of standing. Here is what changes when you lift one foot off the ground. On two legs, your weight is distributed symmetrically. Each calf bears roughly half the load. The micro oscillations of balance, the tiny forward and back, side-to-side postural sway that happens constantly during quiet standing, are distributed across both legs. Each leg is doing a small amount of work. On one leg, all of that load transfers to a single limb. The soleus on the standing leg is now bearing the entire postural challenge. It is not contracting rhythmically the way it does during walking. It is contracting continuously with rapid micro-adjustments, responding to the proprioceptive signals coming from the ankle, the knee, the hip, and the vestibular system in your inner ear. Every fraction of a second, your body is making small corrections to keep your center of mass over a base of support that has been reduced by approximately half. Each of those corrections is a muscle contraction. Each contraction is a pulse of venous return. Your peripheral heart is beating faster. The result is measurable. A 2022 study published in the journal Frontiers in Physiology, conducted at the Cardiovascular Health Laboratory of the Capital University of Physical Education and Sports in Beijing, found that one leg standing produced acute reductions in arterial stiffness in older women, a marker of vascular health that predicts cardiovascular events independent of blood pressure. The mechanism is not simply increased muscle activity, it is the specific pattern of blood flow demand, venous return enhancement, and baroreflex engagement that single-leg standing generates and bilateral standing does not. That word, baroreflex, is the piece of this story that most people have never heard of, and it is the most important part of what is happening in your blood during these 30 seconds. Baroreceptors are mechanoreceptors, pressure-sensitive neurons, located in the walls of two specific structures, the carotid sinus, a small dilation at the bifurcation of the carotid artery in the neck, and the aortic arch, the curved portion of the aorta as it exits the heart. Their job is to measure arterial blood pressure on a beat-by-beat basis by detecting the degree to which the arterial wall is stretched with each heartbeat. They fire action potentials continuously, and the frequency of their firing is directly proportional to the degree of wall stretch, which is directly proportional to arterial pressure. These signals travel via the glossopharyngeal nerve and the vagus nerve to a structure in the brainstem called the nucleus tractus solitariae. The NTS is the primary cardiovascular control center. From there, the signals branch into two efferent pathways, the parasympathetic pathway, which slows the heart, and the sympathetic pathway, which speeds it and causes vasoconstriction. The baroreflex operates as a negative feedback loop. Pressure rises, baroreceptors fire more frequently, NTS increases parasympathetic tone, heart rate slows, pressure falls back toward its set point. Pressure drops, baroreceptors fire less, sympathetic tone increases, heart rate rises, and vessels constrict. Pressure is restored. The speed of this system is extraordinary. The baroreflex can begin to act within a fraction of a single cardiac cycle, faster than a heartbeat. This is why, when you stand up quickly and feel briefly dizzy, the sensation lasts only a second or two before normal perfusion is restored. The baroreflex compensated in real time. When you stand on one leg, you are not causing a dramatic blood pressure drop, but you are introducing an orthostatic challenge. The calf pump is working harder on one side, blood distribution is asymmetric, proprioceptive demand has increased, and the cardiovascular system must respond with finer-grained regulation than bilateral standing requires. The baroreflex is not a binary switch. It is a continuous, high-frequency modulator. Every balance correction your body makes, every micro-adjustment of the ankle, every tension change in the tibialis anterior, every shift of the hip, is simultaneously a cardiovascular signal requiring a cardiovascular response. You are not just balancing. You are running the baroreflex at higher resolution. This matters because baroreflex sensitivity, the sharpness and speed with which the system responds to pressure changes, declines with age, with sedentary behavior, and with cardiovascular disease. A person with poor baroreflex sensitivity cannot regulate blood pressure as quickly or as accurately. They are more susceptible to orthostatic hypotension. They have greater moment-to-moment blood pressure variability. And blood pressure variability, independent of mean blood pressure, is itself a predictor of cardiovascular events. What single-leg standing demands of the baroreflex is not what sitting demands, or even what bilateral standing demands. It is a more complex regulatory challenge. And like any physiological system, the complexity of the challenge influences the sharpness of the adaptation. Now, consider what the proprioceptors are doing during those 30 seconds, because the blood story and the neural story are inseparable. The ankle joint contains some of the densest concentrations of proprioceptors in the body. Muscle spindles within the tibialis anterior, the peroneals, and the calf muscles are continuously reporting changes in muscle length to the spinal cord and cerebellum. Golgi tendon organs at the muscle tendon junctions are reporting tension. Pacinian and Ruffini corpuscles in the joint capsule and ligaments are reporting position and rate of change. The plantar surface of the foot, the sole pressing against the ground, contains mechanoreceptors that report pressure distribution across the entire contact surface. Together, this network provides a real-time map of your center of mass relative to your base of support, updated hundreds of times per second. On one leg, the demand on this system is categorically different from two legs. The base of support is smaller. The moment arm, the distance between your center of mass and the edge of your base of support, is shorter. Small errors in posture that would be trivially corrected on two legs require immediate, larger corrections on one. The ankle is the primary control joint. It is executing what biomechanists call the inverted pendulum strategy. Your entire body is behaving as a single pendulum balanced on the ankle joint, and the ankle musculature is the only actuator available to keep that pendulum from tipping beyond the limits of recovery. The cardiovascular system does not exist in isolation from this proprioceptive demand. Research published in journals tracking cardio-postural interaction has documented that systolic blood pressure oscillates in tight coupling with postural sway during quiet standing. The cardiovascular system is actively participating in balance control, not just passively providing blood supply. The baroreflex and the proprioceptive system are integrated at the level of the brainstem into a single regulatory network that manages both posture and perfusion simultaneously. This is why the 10-second balance test predicts mortality. Not because falling down kills you, though falls are the leading cause of injury-related death in adults over 65, with 37.3 million falls requiring medical attention annually according to the World Health Organization. But because the ability to pass it reflects the integrity of the entire integrated system, proprioception, vestibular function, cerebellar coordination, baroreflex sensitivity, calf muscle pump function, and neuromuscular reserve. When any of these systems begins to degrade, the single leg stance reveals it before a blood panel does. The research is explicit. A study published in the British Journal of Sports Medicine in 2022, drawing on 1,702 participants aged 51 to 75 from the Clinimex exercise cohort study in Rio de Janeiro, found that the inability to hold a one-leg stance for 10 seconds was associated with an 84% heightened risk of death from any cause within the following decade after adjusting for age, sex, and underlying conditions. The same Clinimex group whose earlier work on the sitting rising test we have discussed. The same population, the same clinic, the same methodology. Two simple tests. Can you get up from the floor, and can you stand on one leg for 10 seconds? And together, they sketched the outline of a life expectancy with a precision that took cardiologists decades of imaging and blood tests to approximate. A 2024 study from the Mayo Clinic, published in PLOS One, followed 40 healthy adults over 50 and concluded that balance, specifically single-leg balance, is the physical parameter most rapidly degraded by aging. More than strength, more than gait, more than grip. Adults in their 30s and 40s average 42 to 45 seconds on one leg with eyes open. By their 60s, that number had dropped to 32 seconds. By their 70s, 22 seconds. With eyes closed, removing the visual compensation that allows people to mask proprioceptive and vestibular decline, the numbers are starker. 15 seconds in the 30s to 40s, down to 3 seconds in the 70s. Eyes closed matters because it isolates the proprioceptive and vestibular systems. Vision is the dominant sensory input for balance in most healthy adults. When it is removed, the body must rely entirely on the mechanoreceptors in the joints, muscles, and vestibular apparatus. Aging degrades these systems at different rates, but it degrades all of them. The eyes closed single-leg test is effectively a direct readout of how much proprioceptive reserve the body has maintained. The soleus plays a role here too that extends beyond the acute mechanics of balance and venous return. It is one of the body's primary postural muscles, slow twitch, fatigue resistant, designed for sustained low-level activation across hours of standing and walking. Its mitochondrial density is among the highest of any skeletal muscle in the body. It is metabolically active in ways that the fast-twitch glycolytic muscles of the thigh and hip are not. Recent research has documented that soleus contractions during seated activity, what researchers have called the soleus push-up, produce sustained elevations in local fat and glucose oxidation that dwarf what the rest of the body achieves during conventional aerobic exercise, per unit of muscle mass engaged. The soleus, when active, is metabolically disproportionate to its size. When inactive, as it largely is during chair sitting and bilateral standing rest, that metabolic contribution disappears. Single leg standing forces soleus activation at an intensity that bilateral standing and sitting cannot produce. Not because it is exercise, because the physics of the single leg inverted pendulum demands continuous, finely graded soleus engagement to maintain equilibrium. Your peripheral heart is beating. Your venous return is enhanced. Your baroreflex is engaged at higher resolution, and the muscle that cardiologists call the second heart is doing what it was built to do. You can try to feel this if you are still standing on one leg, 30 seconds on the right, then 30 seconds on the left. Notice whether one side holds longer. Notice whether the fatigue is in the ankle, the calf, or somewhere higher. The hip stabilizers working to keep the pelvis level, the gluteus medius on the standing side contracting to prevent the unsupported hip from dropping. Notice whether closing your eyes makes it significantly harder. If it does, that is your proprioceptive system telling you something that no blood test ordered this year is likely to capture. The body does not degrade all at once. It degrades quietly in the systems that are never asked to perform. Baroreflex sensitivity falls when blood pressure is never perturbed. Proprioception degrades when joints are never loaded asymmetrically. The calf pump weakens when it is never required to do more than the minimum. The inverted pendulum becomes unstable when the ankle is never asked to be the sole actuator of a standing body. 30 seconds, one leg. The blood is moving. The brainstem is working. The peripheral heart is beating faster than it has all day. The other leg is waiting.